The CDC is warning highly contagious strains of the coronavirus are rapidly spreading across the U.S. There are now nearly 1,000 cases reported in 39 states of the 3 variants first reported in the U.K., South Africa, and Brazil. Florida has the majority of these infections, surpassing all other states by more than twice as many cases. This all comes as the Biden administration continues to ramp up its vaccination efforts, but issues with supplies are fueling worries that not everyone will get their second dose. Some local health departments are reporting having to curb or cancel appointments for first doses to ensure the final shot makes it into American arms. Dr. Neeta Ogden is in Rockledge, New Jersey. She's an internal medicine specialist and immunologist and joins us now. So, Dr. Ogden, health experts worry side effects to vaccines could deter people from getting their jab. It's reported that the second dose is likely to feel worse. But, I don't want to make this out to be a bigger deal than it is, because I know that generally when people hear, oh, there's a potential side effect or there's a little pain or soreness in the arm, it gets extrapolated and the headlines blare all over the world, and that makes people more worried about what's going on. But, just bring us back down to earth.
Good morning. Yeah, I agree. I think it's important to be really candid here about the side effects. We're seeing a prime boost vaccination. And after people report after both doses that they experience some very common side effects, things like this, what they call now COVID arm, a very sore arm. They may even have fever, chill, malaise, headaches. I read a story in the news about a school district in Ohio that had to close because they were vaccinating employees and teachers, and they had so many side effects. But this is expected. And people should maybe think about vaccinating on weekends, for example, to avoid that, because you probably might need to take a day off from work. I know in my office, we vaccinated my staff, and that's exactly what happened. So this is predictable, and I don't think that it's alarming. When we start seeing large patterns of very concerning side effects, which we haven't, then, we pay closer attention. Right now, it seems like the majority of side effects we're hearing about are what we expect. And it's really a great sign of our immune system sort of kicking into place, those antibodies gearing up, and immunity really taking over and recognizing that trigger from the vaccine.
So we've seen some sort of positive numbers in some of the sort of areas that we track. A decrease in U.S. infections, decrease in hospitalizations, but experts say the vaccinations, that's not behind that trend. So when might we actually start to see the impacts of the vaccinations?
Yeah, I think there are two things at play here. I wouldn't rule out vaccinations completely. I mean, I agree. There's estimated 33 people have been vaccinated, so that certainly isn't behind this. But then we also have to look at the fact that about 26 million Americans have had COVID. And, epidemiologists say times that by 3, because for every one person who's had it, there are probably 3 people who didn't even know it. And then when you start putting those numbers together, you might be approaching the very beginning of some kind of herd protection, where it's possibly a third of Americans have some form of immunity. So potentially this is driving that decrease. But we also know that that surge we saw was really out of the holidays, and we're out of that period. And so with the masks and social distancing and getting out of that holiday surge, we haven't seen this natural decline. So it may be due to a number of factors. I think the most important thing that everybody's worried about is that if it weren't for these variants, we might be headed in a really great place in the next few months. But we do have a race with these variants, and rolling out the vaccine in a timely fashion, getting as many shots into people's arms as fast as possible. And so far, it's been somewhat choppy. I do have hope that that really is going to change as the administration continues to promise. And we are seeing, close to 1.5 million vaccines given daily. So if we can even increase that more as more things go into place, the Defense Production Act, these massive vaccination centers where, the president is bringing in the military to help, I think we will start approaching those numbers, and we could actually approach that herd immunity by this summer.
So, Dr. Ogden, researchers are getting a better understanding of how the virus mutates. A team of doctors say a man in Boston had the virus evolve inside his body. Explain that to me, and how could this impact, if at all, the effectiveness of vaccines?
Yeah, so, this is really interesting story from Brigham and Women's Hospital in Boston, where a patient who was had autoimmune disease, and was treated with chronic immunosuppressants, basically had coronavirus infection and was never really able to beat it. And that's because he just could not mount a strong enough immune response. So now he has the infection, and he has this sort of low-lying, not good enough immunity. And essentially the virus was allowed to continue to replicate, continue to, do what it does for months. He continually went back to the hospital. He developed pneumonia. So basically, in that kind of environment, the virus continues to replicate and gets to know the immune system. It's almost like a mutational playground now. They have the map of what they can do, and they are finding ways to get around antibody recognition, and that leads to variants developing. Some people have even suggested that convalescent antibody, when it's in low titers, has created this similar kind of scenario. So when you have this low-level immunity that isn't enough to defeat the virus, it now is allowed to sort of wreak havoc and also figure out how to get around that immunity. And that's led to these viruses creating mutations much more quickly than we've seen in the entire pandemic. And we do believe that this has probably led to these variants that we've seen emerging out of other countries. But the other thing there is that it's also due to just so many cases, and anytime the virus is allowed to replicate, that's where we're going to see mutations growing and variants coming out of those countries. So it really comes down to squashing the virus so it doesn't have that opportunity to replicate. And really one of the only ways that we can do that is through successful vaccination efforts.
You mentioned convalescent plasma, which we've heard an awful lot about as a potential treatment. Does that mean that these findings could impact the way we treat the coronavirus?
Yeah, I think that we're moving away from things like convalescent plasma that is like low titers of antibodies. And recently, I think there was another study that basically says that, only high titer convalescent antibody is something that should be looked at for further treatment. And now this is distinct from monoclonal antibodies. Like we, just found out that Eli Lilly has a not monoclonal, a polyclonal antibody, 2 antibody treatment that's been approved for emergency use authorization. So it really depends on how many antibodies and how high they are when we're thinking about these therapies. So we're not really there yet in terms of something that we would use every day. But we do have to give these kinds of things consideration because, as I was saying, a low titer antibody that doesn't really squash the virus can be, kind of like a playground for the virus to mutate and create these variants.
So the FDA just approved Eli Lilly's combination antibody therapy for emergency use. Dr. Ogden, as you know, this treatment is only available for new infections, not for those already hospitalized or on ventilators. Explain to us why that is and how it works.
So this is an antibody treatment that incorporates 2 antibodies. And what they found was that it led to a 70% decrease in hospitalizations and deaths, which is great. And it is for people with mild to moderate disease with the correct risk factors. So people who are high risk. These are patients who are older than 12 years old, and they have risk factors such as diabetes, high blood pressure, obesity, among other things. And again, it's an infusion. So it's really hopeful for that category of patients who can, if they contract the coronavirus, can end up in the hospital and doing very poorly. And it is a matter of accessing it, though. So, like I said, it's an infusion. It's not necessarily something that you can get at your doctor's office. But I think people should be aware that if they meet those criteria, that this is an option for them that they should seek out if they were to develop mild to moderate disease.
Dr. Neeta Ogden, thank you so much.
Thank you for having me.